Another factor I often hear from my patients is I want to wait until I'm in worse pain, or I want to wait until it's my last resort. I understand that surgery is a big decision and shouldn't be taken lightly. However, I often ask patients, how much of your life are you willing to sacrifice before getting to that point? For example, many people say they want to wait until retirement, around the age of 65. That's fine, but I will ask, what does age 63 look like for you? What does that last year before surgery feel like? I've seen many people struggle for years before finally deciding to get a joint replacement, only to say afterward, I wish I had done this sooner. The last thing to consider is your future health status. Some people are generally healthy and physically active, making them good candidates for surgery at any point in time. Others have medical conditions like diabetes, cardiovascular disease, or spinal stenosis, and these conditions independently can affect the way that people move, thus compounding the overall problem of knee or hip arthritis. One of the questions I ask my patient is, do you think that you will be as healthy a year from now as you are today? It's hard to predict the future, but if there's a high likelihood that your health will decline, then delaying surgery may not be the best decision. I've seen patients who plan to get a joint replacement a year later only to develop new health problems that prevented them from being a surgical candidate. Again, a good example is diabetes. If someone has well-controlled type 2 diabetes now, but their condition worsens over the next year, this can lead to poor blood sugar control, and they may no longer be an ideal candidate for joint replacement due to increased surgical risks. The decision to have a joint replacement is a shared decision between the patient and their surgeon. It involves balancing risks, benefits, and probabilities.